My name is Amela Vladovic and I am a student of Faculty of Pharmacy in Sarajevo. Merck is a global pharmaceutical, chemical and life science company with a history that began in 1668 and future shaped by approximately 38,000 employees in 66 countries. Merck products are known and established throughout the world, and Crixivan is one of them. So now we will talk about the 4Ps and the 4Cs. Considering the fact that Crixivan is indicated for the treatment of HIV infections, marketing strategy is basically determined by the huge need for medication of this kind. The product, Indinavir sulfate, has been generally well tolerated and has relatively few drug interactions. Price of the product is adjusted according to Merck's differential pricing policy, and the competition has been eliminated on the behalf of the drug's excellent performance and few side effects. Those were qualities that were recognized by the practitioners, so promotion of that kind was not really essential. Merck decided to aim their marketing campaign directly to customers, and drug availability was actually the main issue, but that was resolved through a specific program that was developed. In the late 90s, many pharmaceutical companies have reduced the amount spent on direct-to-physician advertising, which suggests a tactical shift to their focus from physicians to patients. Direct-to-consumer advertisement for prescription drugs undoubtedly help to educate consumers about available options. At the same time, they encourage consumers to believe that a problem might exist where they previously would not, and that a pharmacological solution is the appropriate way to deal with it. During the one-year study in the late 90s, there were over 200 direct-to-consumer pharmaceutical advertisements in 70 issues of selected magazines. The second most frequently advertised medicines were those to treat a diagnosed disease such as HIV. 7 of those were for Crixivan. Here we can see headline for Crixivan: if you are HIV positive, Crixivan may help you live longer, healthier life. And here we have we can see how from 1996 to 1999 we have increased spending in direct-to-consumer advertising. At the time of Crixivan launch, AIDS was only barely treatable and people were dying, even though there were some medicines. There was a problem with drug resistance, and drugs were very toxic to the system. So there was competition among the companies to produce a drug that will be more effective and less harmful. Now we will talk about the SWOT analysis. The strength was Merck's discovery of the three-dimensional structure of the enzyme protease, which acted like scissors, cutting up key HIV protein and enabling the virus to replicate, as well as the fact that Crixivan was a well-tolerated drug, and up to that point, AIDS was only barely treatable. The weakness was that making a Crixivan actually would require a 6-week process in 15 complicated chemical steps. An opportunity was actually a global need for medication of this kind that would change things. Here we have a diagram that shows an increased number of HIV diagnosed people and decreased number of fatal outcomes among people with HIV starting from 1996. Before that, things were not so good. We can also see a decreased number of people with actual acquired immunodeficiency syndrome. So we can say that Crixivan was a global success among others HIV drugs. In this slide, we can see that in the 90s, it was far more affordable to develop new drugs. So we can say that the market and the opportunities were big in the 1996. Even though future looked promising for Crixivan, there was a threat of public relations disaster, the prospect of running short of supply. That was the biggest threat because there was a big responsibility to ensure a continuous supply to individual patients so that immune resistance to the drug would not develop as a result of insufficient dosage. When we talk about the drug value proposition and drug position statement, the development of a value proposition is not a standalone process, but a part of collaborative effort integrated with other marketing principles. The value proposition must also be integrated into the global pricing and reimbursement strategy, with each country having a clear understanding of the status and price that the value proposition supports. Merck has spent more than 1 billion to create Crixivan, and it has paid off. The drug won the fastest federal approval in regulatory history, and it brings Merck a $500 million in yearly revenue. Merck's pricing strategy, given the different levels of economic development and national strategies, Merck has implemented a different approach for middle-income countries to make meaningful improvements in patient access. Merck's differential pricing policy is a part of its commitment to addressing HIV with the goal of ensuring that its HIV antiretroviral medicines reach as many of those in need as possible.